As fibroblasts become older, they get accumulation of damage in them. They get what we call exhausted.
So aesthetic treatments stimulate exhausted cells. I'm here with Dr. Rahul from Rapalogix to present a new approach modulating mTORC1 receptor to reset cellular function. So at a cellular level, why is mTORC1 system such a critical target in skin aging?
mTORC1, it's been validated as a target. Suppressing of mTOR actually stimulates all the repair processes in the cells. So this is how rapamycin works, for example. All the longevity benefits of rapamycin are through suppression of TORC1. And when you suppress TORC1, cells go into a repair mode. And so if you think of fibroblasts, as fibroblasts become older, they get accumulation of damage in them. They get what we call exhausted. And by suppressing mTORC in the fibroblast, we reset them to a much more younger phenotype that is more active.
So you are emphasizing selection of mTORC1 receptor and not mTORC2 receptor. Why is it so important?
Yes, so mTOR works in two different complexes. mTORC1, which is linked to all of the longevity benefits of rapamycin, for example. mTORC2 is a critical component for skin health, and suppressing mTORC2 is known to create significant damage to the barrier and the structure of the skin, the microstructure. So you want to suppress mTORC1 for the longevity benefits and repair, but you don't want to suppress mTORC2. You want to make sure you can either keep mTORC2 the same or maybe stimulate mTORC2. The stimulating mTORC2 induces the barrier function repair. So that's the key behind our technology, that it is TORC1 specific.
From a clinical standpoint, what are the effects you can measure on the fibroblast?
So if you think of changes to the skin, there are two components, right? There is structure and there is function. Structural changes you can see in a before and after photograph, for example. You can see changes happening to a lot of different things. But longevity requires changes to the function, how the skin functions. And one of the key criteria of function is elasticity. If the skin is able to maintain the elasticity, that means it's functioning better. And so what we found in a double-blind placebo-controlled study is that the product ReQ ProLongevity Serum actually significantly increased elasticity of the skin as early as 2 weeks after patient using it twice a day. So that's the benefit we see early on. And of course, it also had effect on all the skin quality parameters like fine lines and radiance and all those things. But elasticity is something that I have not seen topical products work on elasticity as well as this inhibition of TORC1 is working.
Do you have some marker on senescence?
Yes, so we are in the process of doing biopsy analysis, but all the in vitro studies that we have done show that we actually suppress marker of senescence, we stimulate markers of autophagy, we also stimulate stem cell markers like Yamanaka factors. And so that shows that we are stopping the fibroblasts from becoming senescent. We are repairing them so that we essentially increase the lifespan and health span of fibroblasts. That's the way longevity is defined, is that you want, for individuals, you want to live longer and healthier life. We are bringing that to the level of the cells at fibroblasts. You want fibroblasts to live longer, but also more productive. And by doing that, what happens, you are actually preserving the progenitor cells that don't have to then come and make new fibroblasts. So on long term, not removing cells but keeping them longer in a healthier state is beneficial to the skin to prevent things like dermatoporosis, because you are not exhausting your stem cell bank.
Are you the only one to target this receptor, the mTORC1?
Right now, we are the only one targeting mTORC1, but based on the clinical data that we have received and the early success of the product, I'm sure there will be copies that come in the next few years.
So it's a very shift from stimulating aging cells to repairing them,
yes,
to a reset of them with
yes,
your solution.
Yes, I think we believe that stimulation is required, and all the current anti-aging technologies stimulate fibroblasts, and they are really resilient. They make collagen, elastin, they repair the skin even when they are not optimally functioning. So the exhausted fibroblasts, which all of us have exhausted fibroblasts, that we work either with topical agents or with energy-based devices or biostimulatory fillers. But if you could take those exhausted fibroblasts, make them more active first, then they would work much better and they will keep the skin working for much longer time.
So when you compare your solution with other existing ingredients,
Yeah.
what are the standards you're taking?
I think all the existing ingredients that are more anti-aging, that stimulate fibroblasts to keep the skin healthy, would work much better when they use with TORC1 inhibitor. So we are proposing to create a new category of longevity that sits on top of the anti-aging. So you first repair your cells, make them active, make them younger behaving, and then do your anti-aging treatments that you are doing. So the way we are positioning product is that for younger patients who are not on anything, mTOR inhibition itself is going to be sufficient to benefit their skin. That's what the clinical study shows, that twice daily use of the product itself, we saw significant benefits. For mature population that is already using other anti-aging products like retinoids or exosomes or whatever, adding this on top of that will significantly improve the benefits of those products.
So you have two approaches, younger skin and older
That's
skin
right.
with a routine, and you're going to arrive with proof of the adding effect of both type of
Yeah,
products.
so we have a lot of clinical studies that are going on right now to look at combination of ReQ with other modalities, including energy-based devices. So over the next 6 months to a year, we'll have a lot more data on how this works in combination with other anti-aging modalities.
Thank you very much, Rahul, for this new innovation.
Thank you for the opportunity.
We are really looking forward to seeing much more convincing data.
Thank you very much. And awards like this are really helping us validate the technology from outside peer groups. So thank you for the opportunity.
Thank you.